Welcome to Preceptorship Orientation and Training for Cuesta College RN program. Thank you for being a participant in the preceptorship for these students. My name is Beth Johnson, and I'm one of the instructors, Cuesta College RN program Preceptorship. Let's review the objectives. Course objectives. Understand the role of preceptorship. We're going to examine the key characteristics of a successful preceptor. We're going to identify factors which facilitate the success of precepting. We're going to recognize potential roadblocks to the success of precepting. And then we're going to identify Cuesta College RN student objectives and evaluation process. Let's discuss the purpose of precepting. Precepting is to assist the process from student to nurse, foster growth as they learn the role of bedside nurse, facilitates the transition of a student nurse to their new role as an RN graduate. RN student preceptorship experience. In your role as a preceptor, you will supervise and guide patient care, assure safe patient care, help the student understand the situation, correct the student when needed, guide the student in prioritization, and help the student improve with their time management. Basically, you are the overseer to make sure that the student is practicing within the RN guidelines. Having you there at the bedside, reviewing their charting, reviewing their medications, making sure that they complete their task, and helping them with the priority of how to care for patients along with improving their time management is very important. Role responsibilities defined. As a preceptor, you need to understand the importance of being a preceptor. Apply adult learning principles, which we'll discuss in a later slide more thoroughly. But remember, these principles are that these learners are internally motivated, they're practical, and they already have experience with life knowledge. Validate nursing student competencies. Evaluate nursing student performance. Provide formalized feedback. Assist preceptees' initial phase acclimation to the work environment. And most important, understand what it takes to excel as a preceptor. Let's talk about what does it mean to be an effective preceptor. What are the ideal qualities you think a preceptor should possess? Is it knowledge of nursing, understanding of best practice? Are these preceptors excellent with their nursing skills? Do they have value for professional and personal relationships? The answer is yes to all of the above. Let's think of some of the challenges experienced by you and your preceptee during the preceptor-preceptee process. Feelings overwhelmed when you have so much new information as the preceptee. Expectations not only of you as the preceptor, but as the preceptee. Taking a full team, super busy, no time for teaching and evaluating as the preceptor. That happens to us almost every day. It can be difficult to have a limited team. Often the charge nurse isn't able to comply with that request. Plan of care for each patient instead of a task list. That's what a preceptor should be helping the preceptee with, but sometimes it's a challenge. Being comfortable in the role as a preceptor is very important to helping the preceptee also feel comfortable. Organizing tasks to be better at time management, that can be a really difficult challenge for the preceptee, but you as an excellent nurse, having excellent nursing skills, should be able to help them identify how to better manage their time. Students have some of these challenges as they step into the role during their preceptorship. So remember that both of you can be challenged by the experience, not just you as a preceptor, but the preceptee as well. Let's talk about the characteristics of a good preceptor. These characteristics should embody proficiency as an expert nurse. All of us have heard of beginner, novice to expert, and noting that the preceptee is a novice and that we as preceptors are there to guide them. You need to have a positive attitude. You like nursing and teaching. Being enthusiastic about the role of the preceptor. I'm sure all of us have been with people that were not enthusiastic at teaching us the new procedure or a new skill. You should be regarded as a role model by other nurses. Have a solid communication skill and willingness to give honest feedback. Able to meet students' basic needs. We'll talk a little bit more about basic needs and how important they are to making a preceptee feel comfortable and able to learn. So let's talk a bit about potential pitfalls for precepting. Passive-aggressive communication style. Somebody who talks about the preceptee behind their back. Indirect criticism, where you are talking to someone else but you indirectly put the preceptee down. Being critical and over-demanding of the preceptee, and usually this relates to expectations. Sometimes it's hard for us to go back into our memory and think about that first day that we were on the floor and what it felt like to us as new RNs or in the preceptee process. Not allowing the preceptee to problem solve and gain increasing independence. This actually is probably the most difficult thing, is to not jump in and take care of a problem as a preceptor, to let the preceptee come up with the solution. And lots of times that relates to the preceptor knowing that we have time management that we need to really take care of. Preceptor that doesn't advocate for the preceptee with peers and other healthcare providers. Definitely a roadblock. Poor role model. Makes up your own rules. Instead of paying attention to the policies and procedures of the hospital or paying attention to Cuesta's policies, kind of make up your own rules about how you want things done. And really, the biggest problem would be if you don't like precepting, this is not the role for you. So, as a preceptor, we do want to address those basic human needs. Maslow's hierarchy of needs is important when we're working with our patients, but is also important when we are working with preceptees. It's very important that these needs are addressed for learning to take place. Without these needs being met, growth can't take place. So remember, those are psychological, security and safety. Psychological meaning that you're there for them. They can use you as a sounding board. If they're frustrated, you can talk to them and comfort them. Security and safety, knowing that the preceptee can trust you, and the preceptee being aware that you're trustworthy. They make little mistakes. They say stupid things that come off the top of their head. And instead of chastising them, saying, well, that's a really good thought, but not quite what I was thinking, the direction that we should go. The preceptee needs to be loved and feel like they belong. It doesn't mean you need to go out of your way to express, feelings of love. It just means that you're there and available and open. Make sure that you foster positive self-esteem. And then self-actuation is really important for the preceptee to grow. You can tell if they're feeling actualized by the fact that they like being there, that they enjoy coming. When I was asked a question by a doctor, is a statement they can say. Knowing the answers, that's when they feel actualized. So let's review learning styles. Knowing a learning style can help you tailor your instructing as you're working with a preceptee. Identifying what their best learning style is, usually I ask the preceptee. So there's visual. Those are people that prefer pictures or images. Usually they're people that like to be shown how to do something. Oral, those are auditory musical learners, so lots of times they can listen to instructions over the internet, but hearing how to do something step by step can be helpful. There's the verbal linguistic learners. Those are people that can do writing, like if you tell them how to do something, they're writing at the same time. Often that's a way that they learn best. Physical, kinesthetic, tactile, those are people that prefer actually touching, doing a procedure, something. Logical, those are people that prefer rationale or reason why you do something, and they're able to remember that and keep that in their memory. Social, interpersonal, those are people that prefer to learn kind of in groups together. They don't like to be singled out. Solitary, intrapersonal, those are people that prefer to look at something or study on their own as opposed to they're with you. Like you can give them an article or you can give them an example, a written description, and they can go home and learn about it, and they're able to put that into their memory. So fostering critical thinking. The steps are this: evaluating, assessing what is happening, reviewing, considering plausible interpretations. Why is this happening? Collecting reasonable evidence. What is the significance of what is happening? Choosing the best course of action. So, as expert nurses, we have a tendency to follow these critical thinking steps easily. We don't really think about what we're going to do. We just know because we've been there before. However, the student, they may not have been there before. So it's best for teaching if you talk and think out loud about what's going on. Explain how you do this, or reflection to engage the preceptee as they verbalize these steps. So, example, you have a patient, you go and do their blood pressure. It's 80/54. They're a little difficult to arouse. What are you thinking about that? Well, clearly you're thinking, uh-oh, something's not right. You probably will recheck the blood pressure. You probably, do some tactile stimulation and try to get the patient to arouse. And then you're going to think to yourself, I probably need some help. If the patient, and particularly the blood pressure, is basically the same, or they really aren't arousing and nothing's really changes. Now, that's what you and I would do, but the student may not be able to process that. And that's a pretty simple example. But you know that probably in your head you're going to make sure the person has an IV access. You may start some fluid. You know you're going to call the physician. You know you've already called for help, asked the charge nurse to come down there. Those are all things that come to you automatically. The student, on the other hand, isn't sure what to do. They're panicking. Oh my gosh, blood pressure's low, patient's not arousing. So by talking through the process of the things that you do, that you and I do every day automatically, that will help the preceptee understand how we come to the conclusion. Teaching by thinking out loud. Now, there's been a bit of research on this subject about how expert nurses often come to conclusions without really much conscious thought, because we've had the experience before, we know what's going to happen. So, as you problem solve, Verbalize what you're thinking so that the student can begin to understand your logic and your conclusions. And research has found that senior nurses, proficient expert, often just respond and frequently find it difficult to articulate how they reach the conclusion and actions to respond to the patient's condition. And that's the frustration for the preceptee. They're not sure how the experienced nurse came up with the course of action. So it is difficult for us to remember that we need to think out loud. Practice makes perfect. When I first started teaching precepting basically at the bedside, I wasn't quite sure what the process was. And over the years, I've learned from my experience, just like I have learned as a nurse at the bedside, that there is a process and that the process does make my practice better. The same as with teaching. Teaching definitely is a practice that it takes time to become a good teacher. Allow yourself to make mistakes. Don't be too critical on yourself. I've had many students say, "Oh, I'm not really sure that I would be a very good preceptor," when I've actually witnessed these nurses in their practice and watched them teach families and patients and do an amazing job. The other thing that's really helpful for the preceptee is if you do make a mistake, communicate when you do. Communicate with them. Yeah, I made that mistake before. I learned that you can't do that. That helps them to see also that it's okay to make a mistake, hopefully not one that's going to have a grave outcome, but it's what we do with those mistakes. Listen to feedback. Listening to feedback is one of the most important tools to being a great teacher. And students can give you that feedback, and being patient and listening, not feeling like it's criticism, will be very helpful. Here's some strategies for teaching. Teach by role-playing. Encouraging critical thinking by role-playing. This is very helpful for the preceptee. It helps them kind of do the behind-the-scenes work before they actually are with patients. In particular, if you've got something difficult going on, you assess the patient, something's not quite right. You and the preceptee go, into a room or a space that's quiet, and you can rehearse what your expectations are for the student, and you can rehearse what they're going to say. That'll help them a great deal. You can also do this, like if you're eating lunch, you can think of what if scenarios. What if this happened? Pretend to be the doctor and have the student ask you questions. Try to be the nice doctor. You can pretend to be a patient or family member, and that the student needs to talk to about whatever education, like discharge or doing insulin injections or whatever it is. Try role reversal by asking the student what they think you should do. That will help the student to practice. Other strategies for precepting. Most importantly, coaching. Coaching is number one. Coaching a student is so important to help them, one, meet their basic human needs, but two, they need to have affirmation that you believe that they can be successful. Simulations are a way to coach. That's just practicing. We just talked about that. Role modeling. Show them how to be the good nurse. Show them how something's done. Post-event skill review. Talk about you come out of the room, find a place where other people aren't listening, say, that was really good. What I'd like you to add to that skill is, what I'd like you to add to when you're talking to patients, what I'd like you to add when you're assessing. Positive reflections. You did a really good job with this. I think that when you listen to lung sounds, you need to be really careful to position the patient so you can hear their posterior lung fields. Sharing thoughts. Remember, it's a two-way street. Hear from the student, the preceptee, what it is they are coming to the game with. And you are the same, because remember, you're a team. Articulating clearly the experience, connecting practical applications, that's what's going to help the student learn best. You're the coach, you're the quarterback. So team building exercise, the first meeting. And this is what I recommend the first time you meet with your student. And this doesn't mean that the beginning of the shift, when you first meet your preceptee, that you need to do this. You can do this at lunch or a break, as long as it's within the first or second time that you're working with a student. So think about boundary breaking questions. Ask about 5 or 6 questions of the student you're working with. Like, you can ask them what their professional and personal goals. Ask them how they see their soon-to-be RN role, where they would like to work. Ask them how they best learn, and we talked about, adult learning styles and those learning styles are important to the way that you're going to present information. Ask them what makes them anxious. What are you most afraid of? And here, this is when I always tell the student, I'm not going to let you hurt anybody, because lots of times that's their major fear. They're so afraid that they're going to hurt a patient and cause some sort of horrible outcome. What makes them feel most secure? What do they like to do? They like to talk to you about a procedure before they go into the room? Do they want you to do one they can visually see and then they'll do one? You have to work that out. Share back your thoughts on these questions. This is really going to help you build a team with your preceptee. Stretching the preceptee. This can be difficult. Often when I'm visiting students during their preceptorship process, I usually see 1 or 2 things. I see the preceptor doing too much and not allowing the preceptee to participate in patient care, or I will get feedback from the preceptor that the student just isn't living up to their expectations. So try to think about where the student is. Remember, they're beginning, at the very beginning of learning how to be nurses. They spent 2 years in nursing school and they're at the very end. Some of them are very well actualized into their role. Others are just at that beginning. So expose them to new situations. That's really going to help. Titrate up. Don't let them learn too fast. There can be students that want to do everything, but you're the person that's in charge of governing the amount of skills and information that they need to learn. Simple to complex situations. That's the best way that people learn, so that they can basically layer their learning. Allow for independence. At the same time, remember that you must always keep your patients safe. And I'm sure I'm singing to the choir, because I doubt seriously that any of you have an issue with keeping patients safe. You're all experts. Help students to see that they can someday be an expert in the nursing role. Here's some tips for teaching. To enhance learning, one should establish an atmosphere of collaboration, respect, and confidentiality. Present cases in terms of nurse-patient concerns. If you always stick to the terminology patient concerns, I'm concerned about the patient, that will help the preceptee not feel like the criticism is coming to them personally. Ask what actions the preceptee is going to take. Help them think critically. Review as soon as possible, connecting actions with critical thinking. And most importantly, talk, talk, talk. Research suggests preceptees need structure, interaction, and a feeling of belonging to grow. That goes back to the Maslow's hierarchy of needs and basic human needs. Their learning style must be considered demonstration, talking it through, reading about it, watching it done. Preceptor involvement is a critical element. Letting them go off on their own while you catch up on your charting may not be the best thing for the preceptee. However, it is important that you do allow independence for the preceptee to feel confident. As you've probably gathered, communication strategies are the #1 way to be an effective preceptor. Be very clear with your expectations. Be positive and respectful attitude towards everyone. Preceptees will follow your example. So if you're having difficulty with the lab person or the x-ray person or even the physician, remember that your actions are being watched by the preceptee and they will follow along everything you do. Remember, they hold you in high esteem. In their opinion, you're the king, queen of the world. Provide constructive terminology for the preceptee. Expect that they will not know all of the Cerner documentation. Specialty areas are different, and you might need to help them with those bits of documentation. They are generalists, and they know generally what they should be doing. So if you have a perfect way that you do your documentation, show them what your way is so that they can become more proficient. You role model effective communication strategies. Encourage an open dialogue for two-way communication. It's very important for the preceptee to feel that they can talk to you and confide in you. Documentation communication. Make sure that they understand how important it is to document and communicate families. The information they document about patient communication, doctor communication, pharmacy, agency communication, case manager communication, the therapies, PT, OT, speech, and then even nurse-to-nurse communication when you're doing report and handoff, where they need to document that information. So we've talked a little bit about effective communication, about feedback, about coaching, about how to effectively evaluate and communicate with a student preceptee. So remember, when you're criticizing effectively, you want to target the behavior or skill that needs to be changed, not the person. Avoid talking to them about their attitude. Choose a private, comfortable time. It's best to find a place that no one can overhear you and that the student has privacy. Explain the facts. Don't get into the why. Just ask them, so what was going on there is a good way to start the conversation. Can you help me with what you were thinking regarding whatever it is that you want to talk to them about? Explain the impact of their nursing practice. So they've selected to give a patient Lovenox injection in the arm as opposed to the abdomen. And that's inappropriate according to the Lovenox pharmaceutical company and their description of where Lovenox should be given. So explain the impact of that potential. Ask them to share their perspective. You know, what happened? What made you decide to give the patient the Lovenox in the arm? Ask what they believe needs to be done to fix the problem, whatever the problem is. This helps them think critically and develop critical thinking. I'd like to talk to you about the Cuesta College nursing program's 8 concepts of caring curriculum. These have been emphasized throughout the students' time in our program. We'd like to review these 8 concepts so that you're familiar with our program and what you can expect from your student. These concepts will be part of your evaluation of the student during the preceptorship. Let's talk about the student learning objectives. What are they? The student will provide you with their individualized learning objectives for preceptorship based upon 8 Cuesta College RN caring concepts, which we reviewed on the prior slide. These objectives are measures of their learning while they are working with you. Each objective must be met for the student to achieve their goal of completing preceptorship. You have an instrumental role in their success. Let's talk about the RN student preceptorship evaluation process. Number 1, complete the student evaluation form for the student to graduate. This is a must. They cannot graduate unless this form is returned to me so that they can graduate. The evaluation form is given to the preceptor by the student, so you should have a copy of the evaluation form. 3, to be an ongoing document of student learning objectives. And the best way to do this is that if the student has written that they would like to improve their communication, and in that objective they have requested that they would like to speak with a physician regarding the patient's status, lab value, or medication clarification, you're with them. They call the physician. The physician basically says they're going to write an order and or clarify the med or whatever it is. You can, at the end of the day, look at the objectives, and you can write a date or put a check mark or something so you know, okay, on this date, April the 13th, the student did talk to the physician and was able to satisfy this objective. 4, it should be completed and reviewed with the student so that they know what your evaluation is. Any concerns the student should be shared with a preceptor coordinator, so faculty member, that'd be myself, Beth Johnson, or Kif Mills, prior to the completion of the student shift. We will be coming around. You're welcome to talk to us. Our phone number is available. You can call me anytime. The form must be received by the coordinator in order for the student to complete the program and graduate. So it's very important that we receive the form back. Feedback and evaluation. It's very important to be specific. Look at the students' written learning objectives. What did they say they wanted to achieve during their preceptorship? Write comments that are reflective in that evaluation. If you are having problems, contact the Cuesta College faculty coordinator before you finished the preceptorship shifts and during that time so that we can work on whatever the issues are. Focus on the skill that needs to improve rather than the person. That's a review from prior. Take time to be reflective with the preceptee on a plan for continued process. And always make sure to applaud their successes. Revise challenges with mutually agreed upon behaviors to achieve problematic goals. Student evaluation on their objective goals. Written evaluation. Please write information that is reflective of a student's progress to achieve their written objectives. Remember, those objectives are based upon those 8 caring concepts. The student's learning experience is based upon their learning needs from the written objectives they have defined for the area that they're working in. If you have any questions about completing the evaluation form, please feel free to contact myself, Beth Johnson, or Kif Mills. We're the preceptor faculty coordinators. I want to wholeheartedly thank you for your dedication towards student learning. It takes a lot of time and effort to precept students. It takes a lot of thought, and it's much easier to take care of your patients on your own without having the preceptee. It's much easier to get your work done and not have to concern yourself with talking as you do stuff, showing different skills to the student, helping them to think. It's much easier to do that. So I want to wholeheartedly thank you for dedicating your time to the students' learning and the preceptorship process.